infection started with you anyways. The whole thing just makes me so anxious that I can't even sleep at night. I think we should hit up Walgreens on the way home and try to get some of that stuff I saw on the internet.
Oh, great. What crazy idea did you come from the internet this time?
Well, it's an all-natural sleeping product. I know it's safe because the internet told me it did.
Not everything you read about on the internet is true, Scott. I think it would be best to ask the nurse who should be taking it.
Alright, if you really want me to ask about it, I will. I just think that you're overreacting about this whole situation. We still have time to bail before the nurse comes out, and we can just continue splitting the doxycycline.
Scott, we're ready to see you now.
Oh, great.
Hi, Scott.
Hi.
My name is Carly. I'm going to be here talking to you about your test results today.
Well, no problems, right? I tried to tell my girlfriend that this whole thing is so unnecessary, not to mention embarrassing. I feel 100% fine, and I haven't had any trouble. This whole thing is just absolutely ridiculous.
Actually, we did get your test results back, and it does show that you do have chlamydia as well.
What? Chlamydia? How is that possible? I don't even have any symptoms.
Well, as many as 1 in 4 men with chlamydia have no symptoms. The men that do experience symptoms include burning sensation during urination, penile erectile discharge, and testicular tenderness. It is really important to start treatment because chlamydia infections in men leads to arthritis.
Well, it sounds like I'm better off not having symptoms at all.
We are prescribing you the same antibiotic that your girlfriend was taking earlier.
Oh, the doxycycline? I already took some of her doses. Are you sure I need more?
Well, taking another person's prescription is bad because it can contribute to antibiotic resistance.
Antibiotic resistance? What does that even mean?
It means microorganisms that become resistant to antibiotics that it was previously sensitive to. Standard treatments become ineffective for conditions like yours. Later on, infections caused by resistant microorganisms often fail to respond to conventional treatment. This can result in prolonged illness and lead to death.
Are you saying that I'm going to die? Did my girlfriend, give me a disease that's going to kill me?
I can assure you that if you follow the course of treatment, that your prognosis is good today. For the prescriptions of doxycycline that we are giving, it is important that you finish the entire bottle as prescribed and don't share it with anybody else.
Well, that all makes sense. Can I just have a pill right now?
I want to talk to you about antibiotic first. Doxycycline is a generic name for tetracycline. It is used for the treatment of various infectious diseases, including Lyme disease, anthrax, cholera, peptic ulcer disease, periodontal disease, Rocky Mountain spotted fever, and in your case, chlamydia. Doxycycline works against the microbes by inhibiting protein synthesis, which means the ability to make the proteins. Both bacteria and humans carry out protein synthesis on structures called ribosomes. In human cells, however, tetracycline does not accumulate in sufficient concentrations to stop protein synthesis. This is what makes doxycycline selective for microorganisms but remains safe in humans.
Are you saying that doxycycline prevents proteins from being made only in chlamydia?
Yes, along with all the other microorganisms that doxycycline works against, that is what we call selective toxicity. Now I want to tell you some of the common side effects of doxycycline, since you may experience some of these. They include nausea, vomiting, diarrhea, sensitivity to light, hepatotoxicity, superinfection, and discoloration in the bones and the teeth.
Wait a minute, I'm not taking any drugs that are going to hurt my liver, am I? I mean, I can do that at the bar already by myself. Also, I don't plan on taking any drugs that are going to yellow my teeth and mess up this moneymaker.
Although hepatotoxicity is an adverse side effect, it is not likely to happen in your case. Liver damage is most likely to occur when doxycycline are administered IV at high doses. It also has a tendency to bind to calcium in developing teeth, which results in yellow or brown discoloration. It normally happens to children who take tetracycline between 4 and 8 years because of the time in which their tooth enamel is actually forming. So I think your moneymaker is safe.
You had me worried because I am going to be a male model. That's why I go to tanning beds so much. I really want to improve my appearance for photo shoots.
While taking doxycycline, you actually should avoid sun exposure and tanning beds. It increases the sensitivity of the skin to the UV light, which results in an exaggerated sunburn. While you're taking the antibiotics, avoid prolonged sun exposure, wear protective clothing, and apply sunscreen to exposed skin.
Well, I guess I'll be in the spray tan booth until this chlamydia clears up.
That actually sounds like a great idea. Doxycycline can be administered once a day and be administered with meals.
Wait a minute. I heard that antibiotics from the tetracycline group meant that you can't take it with meals. Are you sure you know what you're talking about?
It is actually true that doxycycline can be taken with food because of the absorption of oral doxycycline is greater than that of the tetracyclines. However, you should avoid taking antacids, zinc, calcium, magnesium, or albumin-containing medications, iron supplements, or sodium bicarbonate. These supplements can decrease the absorption of it.
I don't normally take supplements, but sometimes when my stomach hurts, I take Tums. Does this mean I can't take Tums when my stomach hurts?
Well, if you do end up having an upset stomach, make sure to take the antacid within 1 to 3 hours between doses, or before or after your dose of doxycycline.
Okay.
Also, barbiturates, carbamazepine, or phentoin may decrease the activity of doxycycline.
At least I'm not taking any of those meds. Is there anything else that I should know before I start these pills? It just seems like so much.
Yeah, just one more thing that I wanted to let you know is reasons to call us back at the clinic. So if you start having diarrhea, abdominal cramping, fever, or bloody stool, it could be signs of pseudomembranous colitis. These symptoms could show up even weeks after your treatment's over. Do you have any other questions at all?
Well, my girlfriend really wanted me to ask you about a very safe herbal supplement, valerian, that I saw on the internet. The whole thing with chlamydia is just making me stressed out, and I was going to buy some to help me sleep.
Well, I can actually have Deb come and talk to you about that. That's okay?
Okay. Well, thank you so much for your help.
Perfect. It was nice to meet you.
Nice to meet you, too.
Hi, Scott.
Hi.
My name is Deborah. I heard you were curious about taking valerian.
Well, ever since my girlfriend came down with this thing, and then I came down with this thing, I've been super stressed out and I haven't been able to sleep.
Yeah. Well, valerian is a class of anti-anxiety drugs and sedative. So, you're wanting to take this because you want to sleep?
Yeah, it's just been really difficult because the whole thing has been stressing me out.
Yeah. Well, valerian is a perennial flowering plant. It's an herbal medicine, and it's sometimes called all heal. But the official name is valerian. Like I said before, it is a sedative preparation to promote sleep, so it would help you sleep. And also, some people take it for anti-anxiety or restlessness.
Well, what you're saying sounds perfect. This is just what I need. I knew this drug was perfectly safe.
Well, just because valerian is a plant doesn't mean it's completely safe. There are possible side effects, include drowsiness, and I have some of the side effects here for you to look at. Dizziness, depression, dyspepsia, which is indigestion, headache, dry mouth, and when you stop taking this medicine after a long time, you could also have withdrawal symptoms. And some of those symptoms would include insomnia, irritability, seizures.
That seems like so many side effects. Do you think I should still go and buy it?
Let me teach you a little bit more about what valerian does. So it works by increasing the availability of GABA at the synapse in the CNS. Do you know what GABA is?
No, I've never heard of that before. But does it have anything to do with proteins? Because the doxycycline that I'm supposed to take has to inhibit the making of the proteins. Is that what this does too?
Well, this is a chemical made in the brain, GABA is. And it blocks the signals in the brain. So it directly affects the personality and capability to manage stress. That's why it helps with anti-anxiety, because it blocks those stressful stimulants that are being sent to your brain. When the brain becomes excited or overactive, GABA stimulates the anterior pituitary to release human growth hormone, helping calm the brain and causing you to sleep better.
Is this going to cause me to have that pseudomembranous colitis?
No, but it can cause the withdrawal symptoms like I mentioned. And again, once you stop taking it, if you take it for too long, you could have insomnia.
I guess my girlfriend was right. Again. But I guess it's a good thing that her friend is a nursing student to help us out with all this.
Yeah. There's just a couple more things about valerian. So it should be avoided with alcohol, drug interaction, and opioids. Any drugs that depress the CNS, as that will make you even more. It will kind of potentiate the effect of valerian. Also, you should avoid taking it with caffeine and other drugs that cause drowsiness. And I know that it won't affect you, but someday maybe your girlfriend, she should not take it if she's pregnant or breastfeeding. And so those are the main things about valerian that's good to know before you start taking them. And if you have any main side effects, definitely give us a call. But we've talked about a lot today, and I'd like you to, before we're done here, would you mind just naming off a little bit of what doxycycline, we'll go back to doxycycline and what doxycycline does. And so how should you take doxycycline?
I'm supposed to take it once a day and take it with food.
Good. Are there any side effects to be aware of?
Oh, I need to watch out for nausea, vomiting, or diarrhea. And then if I have worsening diarrhea, abdominal cramping, fever, or bloody stools, I need to call you guys back.
Okay. And what does a bloody stools and fever mean or possibly mean?
That means that you have pseudomembranous colitis.
Okay. What drugs should you avoid while taking Doxy?
Well, I have to be careful when I take my Tums or any other antacid. So if my stomach hurts and I want to take Tums, and I take my doxycycline, I have to wait at least 1 to 3 hours before taking it. And I should also avoid other things like iron supplements or magnesium or zinc.
Good. Are you able to go suntan, or is it good to do
No.
that while you're on doxycycline?
No tanning beds anyway. No more Palm Beach, at least for, until I'm done with all this.
Yeah. Yeah, can you tell me just a little bit about valerian? What are the side effects we need to know about valerian?
Well, let's see here. Drowsiness, dizziness, depression, indigestion, headache, dry mouth, and withdrawal symptoms.
Would it be a good idea to drive while taking valerian?
I guess I probably shouldn't drive since I'm taking it to sleep, huh?
Yeah. What about drug interactions?
No drinking with it.
Okay.
Wait a minute. That sounds something like doxycycline. So I shouldn't take alcohol with valerian or the doxycycline.
That's right.
Benzodiazepines, opioids, antihistamines, and barbiturates.
Great. Sounds like you learned a lot. Do you have any questions?
Nope, I don't think so.
Okay, I know that we give you a lot of information today, so I'm giving you some pamphlets about doxycycline and valerian. So if you have any questions, you can go back to these and read up on it if you have any questions. And always give us a call if you have any of those major symptoms.
Okay.
It was nice talking to you, and I hope you get better sleep.
Thank you so much.
You're welcome.